Hi, my name is Eric Messamore. I'm a psychiatric physician, a pharmacologist, and a university professor, and this is my YouTube channel, Ask a Psychiatrist, where I attempt to provide information that I hope will be useful for people who experience psychiatric symptoms to understand what the cause of those symptoms may be and what treatment options exist. Today I'm going to address a question that came in through the comments section. And the question, as you can see in the text here, revolves around whether an antidepressant, Prozac, will be useful or is likely to be useful for helping to reduce self-harming behavior in a young man. I suppose this is a child or a teen or an adolescent. The young man is living with a stepfather and new stepmother. The environment there allegedly is very stressful, and the way the question is phrased, it seems as if that stressful environment may be driving self-injurious behavior. The family doctor prescribed Prozac, and so the question that I'll address is to what extent antidepressant medications are able to reduce the likelihood for self-injurious behavior. Take anything that you learn here and discuss it with your own treatment provider to see what the right choice is going to be for your particular situation. I want to talk about two things. First, I want to talk about self-injurious behavior. And what I'll tell you is that there are many things that go into producing that particular set of behaviors. After we know about the various things that can cause it, then I will come to the question of what antidepressants may be able to and may not be able to do. Self-injurious behavior, like almost any psychiatric symptom, has a number of different causes. So even though two people may have identical self-injurious behavior patterns, they may not necessarily have identical underlying causes. Self-injurious behavior can accompany a number of psychiatric conditions, for example, depression, anxiety, psychotic disorders, various kinds of personality disorders, which if you've watched the channel, you know is a term that I dislike, but that's the term that the American Psychiatric Association still uses, so we'll go with that for now. As well as they're relatively common in developmental disorders and in autism-spectrum disorders as well. So a number of different psychiatric conditions can be associated with self-injurious behavior. Antidepressant medications can work relatively well to address symptoms of mood disturbance in depression and anxiety. They can work, we can do other videos about this down the road, they can be helpful for some people with various kinds of psychotic disorders. They're less likely to be helpful in these other things. So already we're seeing that the question of whether Prozac can help, the answer is it depends on a lot of factors. In addition to being associated with a variety of different psychiatric causes or psychiatric conditions, self-injurious behavior has a variety of different psychological causes or purposes. On the left hand, these bubbles revolve around the things that self-injurious behavior can do to alter emotional state, broadly speaking. And on the right-hand column of bubbles, these are the things that self-injurious behavior can do to change power dynamics or discussion or relationship dynamics. So let's talk briefly about these left-handed bubbles, the things that relate to emotional changes. In the act of inducing pain, the body tends to follow it with releasing endorphins. And it sounds to me, from my talking with people who have engaged in self-injurious behavior, that it can induce a bit of euphoria. So it's not uncommon for people who engage in repetitive self-injury to say that there's a little bit of a high afterwards, and in some cases, people kind of chase that high. Related to that a little bit is the feeling of numbness. not a small number of people who engage in recurrent self-injurious behavior tell me that when they experience a lot of stress or distress, they notice that they just go numb. They're unable to feel things. And I've been told that the act of self-injury, like cutting or burning or something like that, can help them feel something, and feeling something, even if pain, is better than feeling nothing at all. So some people do this as a way to break through feelings of intense numbness. Other people will describe, for example, when there's a lot of stressful or distressing things happening, the mind will have a lot of kind of like racing thoughts around catastrophe or regret, just a whole mash of unpleasant ideas and thoughts or predictions about the future or criticisms about oneself. And that intense mental noise can be eliminated through acts of self-injury. It's not uncommon for people to tell me that in the act of causing injury, they focus very narrowly on that act. So they can collect the tools that they're going to use. They can think about doing the injurious act. They can carry out the injurious act. They can feel the pain or the euphoria that follows. All of that stuff is focusing the mind on a pretty narrow set of experiences and ideas, thus crowding out all of the other things that were racing thoughts before that were causing great distress. So that's another form of emotional change that self-injurious behavior can accomplish. And other people have the idea that what they're experiencing or what they might have done has been so bad or so intolerable that they need to feel punished in a way in order for them to begin to feel better. It's sort of like I need to punish myself first, and then I can give myself permission to feel less bad about myself, or to perhaps move closer toward forgiving myself. So self-punishment is another form of emotion regulation. Any number of those things can happen. Other things can happen as well. I just focused on things that are relatively common in my experience. So those are a variety of different benefits or approaches or psychological factors that drive self-injurious behavior to change emotion. Now let's talk about changing dynamics of relationships or discussions. Some people will engage in self-injury to emphasize that they feel very badly. So, for example, I can tell you I feel horrible, and you can tell me, I understand you feel horrible. I feel very bad that you feel so badly. I might not feel like I was heard. And no matter what I do or what you tell me to help me understand that you've heard me, I might not feel that I've communicated as well as needs to be just how badly I feel. But if I cut myself, burn myself, do something injurious, then it's like a big exclamation point. So I can feel that my distress has been more effectively communicated. That's one, say, discussion point that self-injurious behavior can accomplish. Imagine that I'm in a discussion with you and we're having some argument and I'm feeling very criticized. I may feel guilty about something that I did or said, or I may feel that you're not listening to me well. I can begin to feel victimized, judged. I can feel powerless in some discussions or relationships. And if I were to engage in cutting, burning, headbanging, some sort of self-injurious thing, it kind of instantly changes those dynamics. So no longer are we talking about my personal failures or shortcomings. We're now talking about, oh my gosh, what do we need to do to remedy the injury that has been created? So it can be an effective way to change topics when topics are distressing or uncomfortable. And related to that, it can be a way to punish somebody else. So if you have said something that hurts my feelings, your apology doesn't quite cut it for me, I may injure myself to sort of show you what you made me do. The sort of subconscious hope is going to be that you will begin to feel maybe as bad as I feel, thus a form of punishment. As I said, There are probably other psychological or dynamic causes to self-injury. These are just some of the more common ones that that have been reported in literature and that I hear about from patients in my practice. Overall point being that there are many possible causes of self-injurious behavior. And if we want to try to reduce or eliminate that kind of behavior, the best approach is first to get a very good understanding of what is the cause. Understanding the cause as well as you can will help to choose the treatment as best as you can. Whether that's going to involve prescribing medicine, it depends upon what we think is the underlying driving factors. So specifically, the question of whether antidepressants are able to reduce self-harm. In cases where there is a disease or a condition that antidepressants are able to treat, and to the extent that those underlying conditions are somehow driving self-injurious behavior, then antidepressants might help to reduce self-injurious behavior. So let's imagine that I'm a very anxious person, and because I have a generalized anxiety disorder, I have maybe bad as well social anxiety, I may have panic disorder or agoraphobia. Imagine that I have some form of pretty significant baseline anxiety. Now imagine that I'm faced with situations which provoke or worsen my anxiety, and I have at some point discovered that headbanging changes things enough that I feel momentary comfort. So imagine that situation. Now, if I'm taking a medicine like Prozac, which actually really does a reasonably good job at reducing anxious symptoms, then my tolerance for frustration improves, and therefore my urges or desires or thoughts about self-injury will decrease. Same thing can be said about depression. If I have a very depressed mood, things that would otherwise just be minor annoyances may, in my state of depression, turn into major annoyances or giant obstacles or things that just really, really bother me. And I may have discovered along the way that inducing pain or self-injury makes me feel a little bit better temporarily. Again, antidepressants are reasonably good at reducing depressed mood associated with depressive disorders. And if my mood is improved because of antidepressants, then things that were massive stressors or irritants now can become minor or tolerable ones. And then my likelihood for engaging in self-injury goes down. On the other hand, if I have just not developed really high levels or adequate levels of frustration tolerance, or if I have just very reactive emotions and I find myself in situations that provoke emotional surges that are uncomfortable, and I've discovered that self-injury effectively changes my emotional state short term, but I don't have anxiety disorder or depressive disorder, then antidepressant medications are probably not going to do a whole lot of good. So to summarize, when self-injurious behavior is somehow related to a symptom that antidepressant medications are able to treat, then there's a reasonable chance that they can help to reduce the frequency of that behavior. When self-injurious behavior is related to other factors or simply something that's become learned and rehearsed, then the likelihood that antidepressant medicines help goes down significantly. We also need to keep in mind the idea that antidepressant medications could worsen things. Antidepressant medications are relatively good at reducing anxiety in people that have anxiety disorders. However, a portion of people with anxiety disorders will find that antidepressant medications make their symptoms much worse, that they induce anxiety or provoke panic attacks. If that happens, I'm probably not going to see a great reduction of self-injury risk. Another side effect that doesn't get talked about a lot is that antidepressant medications can cause numbness or emotional numbness or blunting or something like that. And go back to, some people will engage in self-injury because they feel numb. If they are having a emotional numbing side effect from antidepressant medications, that's just going to make things worse. So that's another pathway in which antidepressant medications might worsen self-injury behavior risk. Another relatively common but relatively not discussed side effect of antidepressant medications is a thing called akathisia, which is a medical term for intense restlessness. People with akathisia often feel as if they can't sit still, or they feel uncomfortable, as if they want to crawl out of their skin. And if one feels worse because of akathisia rather than better, and one has a self-injurious behavior pattern that has been established, then antidepressant medications might make things worse. We need to also always realize that some people are vulnerable to mania because they have bipolar genes, and so antidepressant medications for some people might provoke mania or irritability. And also, this is a warning that appears in every antidepressant that's sold in the United States. Antidepressants have been shown in children or adolescents to slightly but significantly increase the risk for suicidal behaviors, possibly because they cause worsening anxiety or numbness or akathisia, something like that. Regardless of the cause, they have been shown to have a small but significant increased risk for suicidality. So, bottom line being this: any medicine has side effects. Antidepressant side effects include some things that might translate into worsening of self-injurious behavior. So what to do? How to know if antidepressant medications are helping or hurting? I am going to make a video entirely on this topic, how to know if treatments are working. Keep a record of symptoms. This is like the most important thing, one of the most important things that I think anybody could do, and I think everybody ought to do. Treatments are supposed to help reduce symptoms. The only way to know for sure if they're helping with that is to keep track of symptoms. So in self-injurious behavior, relatively simple because the acts of self-injury are pretty easy to recognize. So keep a record or try to estimate how frequently they occurred prior to treatment, and or how severe they were. And then keep a record of self-injurious behavior occurrences after treatment has been started. If a treatment like an antidepressant medication is going to be helpful, you will see that the frequency of those events goes down over time, and they become less frequent, they become less severe, and ideally they go away entirely. Antidepressant medications usually take between 2 to 6 weeks to be fully effective. So if after 6 weeks one hasn't seen a significant reduction of self-injurious behaviors, or if the frequency is increasing, then you've learned that antidepressant medications aren't helpful or are worsening things, and so in that case, you should talk as soon as possible to the person who prescribed the treatment, because that person wants to know, deserves to know, and you deserve a treatment that's going to work. So keeping the record and taking it to the treatment recommender and discussing the fact that it's not working will help to drive treatment toward discover something that does work. So keeping this record and discussing the results with the person who is prescribing the treatment will help you and the treatment provider to understand whether the treatment is working or not. And if it's not working or if it's worsening, then you'll have the option to discuss alternatives that might have a better chance of success. So summarizing, self-injurious behavior has a lot of different causes. Antidepressants might help if those causes are related to a primary mood disorder like major depressive disorder or generalized anxiety disorder, because antidepressants often reduce or improve mood symptoms in those conditions. In cases where self-injurious behavior is not primarily related to a anxiety disorder or depressive disorder, then antidepressants are less likely to be helpful. One should always keep in mind the possibility that a treatment could not work or make things worse. So keeping a record of symptoms prior to and during treatment is an extremely important and powerful intervention that everybody can do and should do to make sure that treatment is moving in the direction that everybody wants. And if it's not, then do by all means have discussions with the prescriber or the treatment provider about what's been happening so that you can search for alternatives that will have a better chance for success. Thanks for the question and thanks for watching. I'm going to do a longer version of this discussion in the audio podcast, Ask a Psychiatrist. So go to Apple Podcasts or Google Podcasts or Spotify, and look for that podcast if you'd like to hear more. And if you have a question, send it to me in the comments below, or send it to me through askapsychiatrist.info, my website for this channel and podcast, because I want you to have good information so that you can discuss it with your doctor or care provider to help get better results from treatment and move into full and lasting recovery. Thanks again for watching this, for your interest in the channel, and if you found value to this, please hit the like button below. We'll see you next time.